Hi guys, my name's Elena Garcia and I'm doing my capstone on the benefits of breastfeeding. So I have some papers and pamphlets that I have that I'll be showing you guys shortly. I'll also be reading to you guys as well. So, like I said, I did my review, my literature review capstone on the benefits of breastfeeding. So I'll touch on research back ideas of why it's beneficial for mothers to breastfeed their children. And some topics I will be discussing are the health benefits, not just for the child, but for the mother as well. There's a lot of mothers that are unaware of how beneficial it is, not only to them, but to their child. And some people are unaware um, of how to even breastfeed, get their children to latch on. So I'm hoping that this paper and what I've written will encourage parents to breastfeed, and also maybe it'll bring awareness and people start doing more research and gain knowledge. And with this knowledge, we'll be able to pass it on to mothers. So in today's age, we at times see public shaming through social media when a mother breastfeeds their child in public. So that's probably another reason why mothers don't breastfeed, because they feel like it's not appropriate. But that's the main reason or main way to get nutrients to their child and keep their child healthy um, and fed. So that's why I picked this topic. I like to shed the light and perhaps create a normality when it comes to breastfeeding. Some topics I will discuss are the benefits of brain development for the child, the correlation between postpartum depression and breastfeeding, as well as the effect breastfeeding has on the development of motor skills and cognitive skills. During the early childhood development stage, I feel it is important we educate ourselves so we better understand how to treat our students, patients, and children if we notice any deficits within their motor or cognitive skill development. I grew interest in this topic because my goal is to work with all types of children as a teacher, as a maybe occupational therapist or something. Who knows? But by better understanding the direct correlation between the nutrients and benefits created from breastfeeding, perhaps it will help me become a better teacher towards my students. And with this knowledge, I can educate the parents on the importance of how breastfeeding can be beneficial to both the child and the mother. For many communities, this type of information is unknown, and I would like to create an opportunity for others to become educated on this topic. There are many benefits to breastfeeding your children. Breastfeeding your child can help fight off disease as well as infections. Some benefits to a child that is breastfed is an enhanced immune system, nutritional and growth benefits, and also reduced risk of chronic disease. Breastfeeding not only benefits the child, but it also benefits the mother as well. As stated, mothers who breastfeed experience less postpartum bleeding, earlier return to pre-pregnancy weight, and reduced risks of ovarian cancer and premenopausal breast cancer. Studies have been done and have found that children who are breastfed have stronger immune systems and can fight off infections. The longer the child is breastfed, the stronger the child's immune system gets. So this is very important, especially when you're sending your kids to school, because when a kid's sick, that means they have to miss days. So with a strong immune system, maybe fewer days that they would have to take if they were to get sick. Although there are cautions and about breastfeeding, and mothers need to inform doctors of any addictions or certain conditions they may have. The purpose of this paper is to explore the benefits of breastfeeding children and the research that has been done to prove it. Several studies have been done and have suggested that breastfeeding has a long-term influence on brain development. The aim of the present study was to examine association between breastfeeding and 3 developmental milestones related to fine motor skills. General motor skills and early language development at the age of 8 months. The child's brain development has an impact on his or her life through these evaluations. they can determine the growth of the child. Some studies that were done on the children that were being evaluated of these developmental skills were evaluations of crawling, babbling, and the pincer grip. The study concluded that infants who were breastfed had mastered these skills. Another study that was done also states the significant higher level of cognitive function were seen in infants who were breastfed when compared with formula-fed children at 6 to 23 months of age and in older children. Human milk contains substances essential for the best neurodevelopment that cannot be found in milk formula. For this study, a health visitor interviewed children and had mothers fill out a questionnaire. There are many studies that back up the fact that breast milk is beneficial for the child's brain and cognitive development. Human milk contains antibodies to the bonding site of maternal antibodies against many diseases. Studies have shown that children who are breastfed show a higher protection rate of fighting infections. Human milk contains many growth factors that play a very important role in the development of the immune system. Breastfeeding might also decrease the risk of developing diabetes and arthritis as well as child obesity. And child obesity has been at its high, so it's very beneficial to be breastfed. Especially, we know that it's at a high, so the more we know, the more we can spread the word. Breastfeeding makes children healthier and is helpful and anti-infectious. Breastfeeding has many nutrients and fights many infections. With healthier children that are being breastfed means less doctor visits and less missed days of school, like I have mentioned before. A study was done to identify the causal effect of breastfeeding and postpartum depression. Postpartum depression is a common condition in which approximately 10 to 20% of mothers are affected at any time up to 1 year following childbirth. Postpartum studies have found that it is directly associated with the ending or conclusion of the child being breastfed. Women who experience severe pain during breastfeeding are more likely to experience postpartum depression. It is suggested that the correlation between breastfeeding and postpartum depression is complex, wherein women who breastfeed experience a protective effect against lower levels of depression when compared to the non-breastfeeding their non-breastfeeding counterparts. And women with prenatal depression are said to be more predictive of breastfeeding less soon after giving birth. There are many ways to enhance the breastfeeding experience, since it is so beneficial to the child and the mother. A couple of ways to enhance the experience is to encourage the mother. And we can support them, we can find resources, we can offer, there's lots of help that we can get for mothers. So mothers who have depressive symptoms are more than likely to either not breastfeed or breastfeed for a short amount of time. Children who are breastfed have fewer illnesses than those who were never breastfed. There are many benefits and healthy outcomes of breastfeeding. Human milk helps the immune system fight off infections. It also contains nutrients to help child's growth and development. Children are leaner and can easily digest human milk. Breast milk also reduces the risk of type 1 and type 2 diabetes, inflammatory bowel disease, childhood cancer, and allergic disease such as asthma. Brain growth and development are also a positive factor in human milk. Breastfeeding has a positive effect on the mother. Mothers who breastfed their infants may also experience psychological benefits, such as increased self-confidence and facilitated bonding with their infants. Studies have shown that breastfeeding for longer periods, up to 2 years, and among the younger mothers, early 20s, may reduce the risk of premenopausal and possibly postmenopausal breast cancer. So it's very important for mothers to breastfeed their child. It's not only beneficial, but it saves families lots of money. They have a positive long-term effect on children, and I think people need to be educated on the importance of breastfeeding. So I have a couple of things I would like to show you guys. Successful breastfeeding poster, the benefits of breastfeeding mother, how it helps. It tells us what's in breast milk, all the nutrients. It can help build a stronger bond between you and the baby, lowers your risk of getting breast and ovarian cancer, like I said. So I believe this is very important to see and to read. And also, 10 things you need to know about exclusive breastfeeding. It saves lives, it provides nutrients, it ensures clean and safe source of food, it makes children grow, it breaks the cycle of diarrhea, bonds mother and child, reduces the risk of ovarian and breast cancer, helps space pregnancies, a natural method of birth control, saves money, protects the environment. So here's this as well. So here's good for the baby. Here's something else you guys can read. So it aids weight loss, greater IQ, boosts the immune system, supports the baby's growth and development, stuff that I have already mentioned to you guys. So, healthy mothers, healthy babies. I hope you enjoyed my capstone review. I think it's very, very important that we gain knowledge and we know the importance so we can pass it on to expectant mothers, maybe family members, cousins, sisters, aunts. It's very, very important, and it's very healthy for the mother and also for the child. It makes your child strong. It helps them grow, helps them develop, and they'll be able to do things at school that maybe some kids are having trouble doing. So I'm hoping to I gain knowledge because I one day want to open a resource center, and I just want to give parents as much resources and as much information that I know that can help their child develop, especially when they go to school, because so many children are behind. I feel if there's a way parents can help, then here's one way that they can do it. And if I can give them the proper resources, I'm all for it, and I want to bring awareness. So I hope you enjoyed my video. It's my first time doing it, so and I hope that these little flyers I showed you guys gave you a better understanding. And it's just stuff that I talked about, and I went over how it's important to help fight with the immune system. And that's really, really important to have a strong immune system, and especially brain development in school. And it shows the importance. Here's the flyer. It shows the importance of breastfeeding. So I hope you enjoyed. Please give me feedback on this and anything else you think I missed or you would like to know. I'll be more than happy to answer any questions. So thank you, and good luck to the rest of you guys. And we're almost done. One more week. Thank you guys. Have a nice day.